Thank you, Michelle, and a pleasant good afternoon to everyone. It's my task to share with you the Health Emergency Operating Committee Situation Report for today, Wednesday, November 10. The COVID-19 pandemic continues, and in the Federation, we continue to respond to this crisis. Now, over this past week, we've identified 44 newly diagnosed cases of COVID-19, and this brings our total to over 2,730. Now, at present, or during this past week, we've had 4 admissions to the hospitals, 7 discharges, and 84 cases have recovered. But most importantly, we've added or counted 2 additional COVID-19 related deaths. These individuals were elderly and unvaccinated. The Federation has reported a total of 2,730 confirmed cases of COVID-19 to date, with 444 of these cases on NEOC and 2,286 SEN kits. It's interesting and it's important to note that our cases continue to recover. We've counted 2,609 recoveries to date. Now that leaves us with 94 active cases. So we are monitoring 23 active cases on the island of Nevis and 71 active cases in SEN kits. Now, this brings me back to early or mid-August when our active cases was similar, 94. So it's 3 months ago. It took us 3 months to bring the number of active cases down to below 100, and that's significant. In terms of hospitalizations, we have 3 COVID-19 cases admitted at the JNF General Hospital. And as you've heard already, we now have a total, or we've now counted a total of 27 COVID-19 related deaths. We've looked at the data, related to these deaths, and 23 of these 27 cases were unvaccinated, or 85% of the deaths unvaccinated. 19 of the 27, or 70% of those who died, were 60 years and over. So in other words, if you really analyze this, if you are 60 years and over, and if you're still unvaccinated, your risk of picking up COVID is significant. And if you have underlying comorbidities, your risk of if you do pick up COVID, you can easily progress to moderate and severe COVID disease. So if you are 50 years and over, if you are 60 years and over, and you've not yet come forward to accept the vaccine, we want you to empower yourselves and come on board. We've analyzed the data, pertaining to the positive cases, and to date, 67.4% of our cases unvaccinated, 24.7% fully vaccinated, and almost 8% partially, or just one dose on board. And so in essence, if you are unvaccinated, your risk of picking up COVID is significant. We continue our COVID-19 vaccination program. Over the past 8 months, we've been administering the AstraZeneca Oxford vaccine, and as of 1st of September, we've added the Pfizer BioNTech vaccine. To date, we've achieved the following coverage rates. 77.6% of the adults in our population have come forward and have accepted the first dose. 73.3% are fully vaccinated with 2 doses on board. Now, in terms of our children, 12 to 17 years, 12.8% of the children within this age band have come forward and received the first dose of the Pfizer-BioNTech vaccine, and 9.8% or almost 10% are fully vaccinated. And so again, we are reaching out to the parents and guardians to empower yourselves and protect in terms of protecting your children. So to date, 52.3% of our total population is fully vaccinated, and this is an achievement. The Pan American Health Organization, has acknowledged us in this regard. They've penned an article with global reach. The link is provided. The COVID-19 pandemic continues. The SARS-CoV-2 virus remains a formidable foe. The outbreaks continue in the Caribbean region. At present, Anguilla is experiencing an increase in cases, so is Barbados, Belize, Bonaire, Cayman Islands, Dominica. So the virus is circulating in the Caribbean region, and it's circulating globally. The pandemic continues. Now, we note that there is a surge of cases in Europe. So Europe is experiencing an increase in the number of cases, and they are preparing for an increase in the number of deaths, as much as 500,000 between now and February 2022. Ladies and gentlemen, there's no room for complacency at this time. Complacency is not an option. So yes, our numbers may be down. However, please note that our borders are open. We are now receiving daily flights. Commercial flights are coming in daily. We see or we note an increase in the number of cruise ships that are docking, and this will continue for the rest of the year. And we are approaching Christmas, Carnival. And so we are going to see an increase in traffic in terms of inbound travelers. And so the risk of a fourth wave is very real. So I want us to remember this, and complacency is not an option. We cannot become complacent at this time. We need all hands on deck in terms of delaying and I dare say preventing a fourth wave. We have weapons at our disposal in terms of the COVID-19 prevention and social measures. Let's use them and prevent this fourth wave. It's possible. The vaccination is our best weapon. So we need to continue our vaccination program. We in the Ministry of Health, we continue, we are at your disposal in terms of health talks or whatever it is you need to empower yourselves in terms of coming on board. Now, I read an article in The Economist whereby the author was trying to predict what would 2022 look like. And based on what he posited, and I quote, "In the well-vaccinated, wealthier countries of the world, year 2022 of the pandemic will be better than year 2, which is 2021. And COVID-19 will have much less impact on health and everyday activities." So in other words, those countries which have achieved acceptable or high vaccination rates, they are predicting that they will do better, fare better in 2022 versus 2021. Those countries who have not attained a significant vaccination coverage, those countries with high level of hesitancy may not fare as well as the richer countries that are well vaccinated. And so vaccination remains our best weapon. Let's use it. Wearing the face mask is simple, it's affordable, and let's protect ourselves. We must move from place to place. If you're using public transportation, remember your face mask. If you are going to travel overseas, make sure to wear a face mask that's going to protect you. If you're going to church, you're going to the movies, you're going to the grocery store, you're going to the bank, or you're going to pay your utility bill, remember to keep your face mask on. Cover your nose and your mouth. So the face mask is another weapon that we must use to prevent a fourth wave. Hand sanitization. I have a new respect for this. I recently traveled, and I think this is what prevented me from picking up COVID, because I went into the hot spots, but I made sure to sanitize my hands after interacting with anyone, after touching any surfaces or all those high-touch surfaces. I sanitized my hands, and I kept my hands out of my face, nose, and mouth. It's very, very important to maintain adequate hand hygiene. That's another weapon that can help us to prevent the fourth wave. Social distancing. We are social beings, and recreation is a part of life, but we need to be selective and we need to be wise in the context of COVID-19. And so we need to be careful, where we go, what games we watch. You need to look at the crowds and protect yourself. Maintain that adequate distance between yourselves and others. So keeping and maintaining that social distance is of importance at this time as we approach Christmas and in the context of our borders being opened. This is another weapon that we can use to prevent that fourth wave. Ladies and gentlemen, we want all hands on deck in terms of preventing a fourth wave. Thank you.